well, in this lab, we've been working, of course, with spinal cord injury, but we know by talking to patients that the major problems associated with spinal cord injury are the development of chronic complications such as pain and spasticity. And so we are trying here to actually help as much as we can with the medical doctors and physiotherapists by creating new tools to do a diagnosis of these problems and also new treatments. We also know from some basic experiments we've done in animals that just after spinal cord injury, the presence or the development of special factors such as bleeding are very important in determining the development of these complications. So it's very important to try and understand whether there's a lot of bleeding or not after spinal cord injury. We also know that if we're not capable of detecting these chronic complications in the early phase of spinal cord injury, then the rehab process is probably going to be much slower, and in fact actually may impede the application of new treatments in the future. The research lines we have here, of course, as I said before, they're oriented in looking at the real problems of patients here, where we can help, for instance, from the development of a new pharmacological tool, a new drug to treat spasticity and pain, to, for example, developing a questionnaire which will be useful for both patients and medics to diagnose different types of spasticity and pain during the lives of the patients. So we have two labs here, a basic and a clinical lab. We work hand in hand. We have biologists, physiotherapists, neurologists, medics, all working together, looking for ways of spotting the development of these chronic complications in patients. And we're also very interested in trying to look at different symptoms of spasticity, such as rigidity or spasms, and symptoms of pain, such as this continuous type of pain, or pain that appears and disappears for no type of reason whatsoever. The type of treatments that we're looking at are mainly focused at the pharmacological level, although as we have many physiotherapists in the lab, we're also evaluating new types of physical therapy types of treatments and neuromodulation. Well, in the last few years, we have had quite a number of advances. In the basic lab with the animals, we've discovered 2 or 3 natural molecules based on fatty acids. These are the omega-3 and the omega-9 fatty acids, where we know that if we use animal models of spinal cord injury, we get much more growth of neurons below the spinal cord injury, and that the animals are able to run faster, better, and they also have less evidence of these uncontrollable contractions that we see with spasticity. So this is very nice. These drugs have now been recognized by Europe as orphan drugs, and they are patented, and we're collaborating with small spin-off companies and larger multinational companies. So we're looking very good here. In the clinical side of things, what we have done is to develop, say, tools to look at early signals, warning signals, that spasticity and pain are developing in these patients. And this is very important, and we've designed this so that we have simple questionnaires that both medics and patients can use at home. Treatments also are very important, of course, to try and treat the spasticity and pain. What we try to do here is to try and match up different types of treatments, pharmacological, physiotherapy, neuromodulation, and to see whether one of these types of treatments are better to give a better individual response of a patient to the treatments. So we're matching treatment types with the types of symptoms they have. We are well connected with leading basic and clinical scientists working in spasticity and pain after spinal cord injury. We're very lucky there to have that. As a British person, I have quite a few contacts in the UK, Scotland, Glasgow, Liverpool, London, Stoke Mandeville, which is very nice. We also have connections, of course, with our drugs, developing with small spin-offs in Mallorca, Lipopharma, and also with larger multinationals. We are also the responsible arm for 3 networks in Europe. One is the European Medical Hospital working on spinal cord injury. We're also in negotiation with ISCOS, which is part of the spinal cord international group of people in the world. And also we have a network of scientists working on pain after spinal cord injury.